We have two possible aspects. The more one is to stratify patients for the stroke risk, and we have now good models to stratify the stroke risk of the patient. Even if none of the available models include the history of previous ICH, that is a clear risk factor for having an ischemic stroke. So probably when we apply a stratification model to this patient, we should bear in mind this information, and probably our patient has a risk higher than that we can derive from the model applied. The second aspect is we have now a new class of drugs that are direct oral anticoagulants that have been used in patients with atrial fibrillation that cannot be used, for example, in patients who have mechanical heart valves, but can be used in patients with atrial fibrillation that have shown reduction estimated in about half reduction in the risk of intracerebral hemorrhage in patients treated with this drug with respect to treated with warfarin. However, we don't have the randomized trial that indicate that these drugs have the same characteristics when used in patients with the previous ICH, even if the first observational data seems to indicate that this is true.